Hi, welcome to Low Tech Whiteboard Learning. Today's topic is fever and how we work it up and what we do to figure out the cause. So, the first thing to talk about is the difference between fever, a true fever, and hyperthermia. So, hyperthermia are sort of the examples you think of are heat stroke or when you have been in a car, could be the same thing. When you are overdoing it with exercise, when you're anxious or stressed in animals, we think their temperature might go up a little bit from that. And so that is an excessive gain of heat without being able to lose it fast enough. So you don't have enough loss of the heat that you're gaining from whatever process is going on, you can't lose it. Whereas a true fever is a change in the temperature so that your body wants to be hot. So if you have a thermostat in your brain that says, I'm going to be somewhere between 98 and 100, and you're sleeping, you're going to be over here by 98. But the thermostat might change if you're exercising or moving around. You're going to do a little bit more stuff and be more active. And that's what happens with fever, is your body actually says, nope, I'm going to be even hotter. And that decision is made in the brain. So you have a little generic brain, you have a little cerebellum, you have a brain, a spinal cord, and brainstem to spinal cord. There's a little place called the hypothalamus. And there is a prostaglandin, an inflammatory mediator, that helps set that point. And it tells you when to throw off the covers because you're too hot, or it tells you to put on the covers because you're too cold. And when you have a true fever, there's a message to the brain that says, up that temperature because we want to do something like fight an infection, or we have so much inflammation in the body, it's telling us to increase the temperature anyway. So then that's why we can talk about the causes of a true fever are related to inflammatory mediators. So there are 4 causes of fever, and the first one, that makes sense, is just inflammation. If you have inflammation in your body, it's going to increase your temperature. And this is big inflammation. This isn't like I cut my finger and I have a little inflammation. So big inflammation might be pancreatitis, or it might be a sterile peritonitis. So when you rupture a bladder and your urine is sterile, sometimes, most of the time, you might still get inflammation. Or if your gallbladder ruptures, it might be sterile, but it still cause inflammation. And the other one is trauma. And you can get crush injury to your muscles and they're inflamed, things like that. So then the second and third and fourth are more things that cause inflammation and then cause the temperature to go up. So the first one you think of is usually infection. So there's lots of different infections, right? Bacteria, virus, tick-borne diseases. So lots of different things under there. The third one that works by the same mediators of inflammatory diseases is cancer. And that's also called neoplasia, is the fancy word for that. And so cancer, those cells will just release all the same bad inflammatory mediators that an infection will, and fool the body into this inflammatory problem and up the temperature. The fourth one makes sense too. In a way, it's just inflammation, but immune disease. So immune disease is where you're attacking your own body, and something has gone awry like that. Usually those are like anemias or platelet problems. So ITP, immune-mediated platelet disorder, or IMHA, immune-mediated hemolytic anemia, immune-mediated. Or you can have other kinds like lupus, things like that. So those are the 4 causes of fever, and what you do when you're working it up is try to put yourself into one of those categories with your patient. So how do we do that? Well, the first thing that you do, low tech, is get a proper signalment and history, right? So what will signalment and history teach you? Let's talk about gender. So a female intact patient may have more risk factors for pyometra or mammary cancer, things like that. If you're a male intact, you might have more problem for prostate cancer or prostate infections with weird organisms if you're breeding. If you are old or young, you will have different diseases that might cause fever. So if you're young, maybe you're more likely to have parvo or a viral disease. If you're old, you might be more likely to have cancer. If you then also look at breed, so breed, you might have a Cocker Spaniel. They're very prone to immune disease. You might have a Golden Retriever who's much more prone to cancer. So breed is important. And then in the history, one of the most important things is travel or location. So what the studies have found is that if you are in a location that has fungal organisms like blastomycoses, coccidiomycoses, you might get that disease. So that makes sense. If you've been to a place with heartworm, you might get that disease. And so that's really important, is to see where a patient has been. And if also how much time they spent there. Were they on prophylactic medications? The next level of things that you're going to do is an exam, right? So you're going to look at the patient. And that exam has to be head to tail. Because you don't want to miss things. You don't want to miss an anal gland abscess because you didn't rectal. So you must rectal, the patient, the doctor must. The other thing is to look at the retinas, especially in cats. Sometimes cats with feline infectious peritonitis will have retinal lesions if they have dry FIP. So the other thing that we sometimes do as part of our quick exams is an A-fast and a T-fast, and that's looking for fluids, right? So if you have a fever cat and you look in the chest, you might find a pyothorax or other fluid in there. If you do an abdominal fast scan, you might find fluid again and be able to figure that out. So we kind of use that as an extension of our exam. But you want to do a really good exam and make sure that you check for places that might be hidden from first glance. So the other part of the history is obviously to make sure you know, other than not feeling good from a fever, what is their main complaint. So if it's vomiting, you might be now thinking, oh, I got to look at the gut. If it is breathing bad, you might want to be looking at the lungs. So history is also going to help you point toward the right direction for the next step, which is, what test do I do to figure this out? And I like to break it down into levels, because the levels, as you get higher in the levels of testing, the cost goes up. So level one testing, that is going to consist of the easy stuff, right? A CBC, or complete blood count. Now what can that tell you? Do you have an increase in white cells? Do you have enough red blood cells? Do you have enough platelets? Do you have signs of infection like bands? Do you have leukemia, which is the only cancer we can pick up on basic blood work directly? Chemistry. Now that's only going to tell you what organ is in trouble. So that isn't as helpful as maybe we would think it would be, but it does point us in the right direction. And a urine sample, urinalysis, we're going to look for infection or other risk factors like a low concentration of the urine, a USG, a urine specific gravity. We might do a thyroid in a cat. We might do FELV, FIV, feline leukemia and immunodeficiency virus in a cat. We might do a 40X SNAP, which if you don't know what that is when you look at heartworm, Lyme, Ehrlichia, and Anaplasma on a little in-house SNAP test. We might do a pancreatitis SNAP test, really pretty easy to do. We might do something as simple as a fecal, if it is a puppy. So there could be all kinds of oviparasite Giardia. So lots of things we might do is level one, nothing too complex. So then we have to say, did we find the answer or not? And a lot of times we don't find the answer. Now, a lot of times I have to say, back up for a second, we don't even get to level one testing in some of these fever patients because it was easy. Like there was an abscess. There was something we picked up when we did our fast scan. There is an exposure to kennel cough and we don't even bother to do more stuff. So a lot of times you don't necessarily get to blood work and everything if you already figured it out. So the level 2 testing, that is when you start to get into imaging. and you might do a chest x-ray, an abdominal x-ray, or maybe you'll do an abdominal ultrasound. Now, the difference between those two is, they're significantly better at looking at certain things. So if you're looking for like a coin, or if you're looking for the shape of an organ, you might do an x-ray. If you're trying to look interiorly, to look at the gallbladder, at the kidneys, you're going to probably choose an ultrasound. So what if you still haven't found the answer? Then you really might have to go to level 3 testing, and that's where the money starts to add up. But let's talk about something before we talk about level 3, and that is something called fever of unknown or undetermined origin. So by this time you've done some stuff and you haven't found the answer, people start to break out this term, fever of unknown origin. And I have a problem with that, because likely it's unknown because you haven't done enough tests to figure the answer out. And maybe it hasn't even been long enough that they've had a fever to really say you don't know what it's from, right? So I like to call it undetermined, because we might determine if we did more tests. So what are level 3 tests? Well, when they looked in the literature at dogs and cats who had come in for fever workup, and they couldn't figure it out on level 1 and level 2 and signalement and travel history, what was the most likely thing that caused the fever? Well, in cats, it was viral diseases. And in dogs, it was immune-mediated polyarthropathy, sometimes called IPA. So joint taps are how you figure this out. So that's a big deal, right? Not everybody's going to commit to joint taps under sedation. And viral testing is now easier than it used to be. You can do a respiratory PCR, and that'll look for some of them even if they don't have signs of upper respiratory infection. And there's also another panel called a fever panel that looks at a few more things if they have a travel history. But these were the most likely causes of a fever of undetermined origin. But if that's not what your patient has, you may have to do even kind of more interesting things. Let's say you think your pet is a little bit neurologic. You might do an MRI, you might do a spinal tap, you might do spinal rads, you might do certain titers for different diseases like neospora that affects the brain. So there might be things that you do. If you think your pet has a vague abdominal problem, you might do a CT of the abdomen. If you think it has low cells, like low white cells or platelets, but it's not immune, you might do a bone marrow. You might do lymph node aspirates, or you might do spleen and liver. Sometimes we just do that when we're trying to look around for diseases in different organs. So there's a bunch of different things that you could do. This starts to just get more complex. And then what they say in human medicine is if you don't find the answer still and you do all those tests, start over. Because maybe something is now much more obvious than it was the first time you went around. Okay, so last thing we're going to do is just talk about treatment. Should you treat a fever while you're waiting for the answers to figure it out, or if you figure you're just not sure, or if it's viral? So should you treat? And I tend to not treat, because like in humans, we would take Tylenol. First of all, Tylenol is toxic to cats. And in dogs, you have to be very careful. So we're not going to do that in our animals, in our patients. So should we treat? Well, in human medicine, they have found that if you do treat with Tylenol, you might increase the time that you're sick, because viruses may be affected by your lowering the body temperature, which tells you that having a fever is smart. Your body is trying, in a case of an infection, to kill the organism that's in its body. Now, it can get out of control, and maybe you're not feeling hungry and you're feeling terrible, and especially if it's 3, 4, 5 days you have a fever, that's not great. But your body is really fighting for a reason. So if you take away the fever, you might actually disrupt your ability to fight the infection. So the other thing that is hard about treating a fever, it takes away my ability to know when you are better. So I won't know that the fever's gone if I have you on anti-inflammatories all the time. to disrupt this cascade and get your temperature back down. The other thing is it doesn't last very long. And so if you know that, you take a Tylenol or a medication and you're good for a few hours and then it comes back. And so you've got to be giving them all the time, which may not be very good for them because a lot of non-steroidal anti-inflammatories are hard on the gut. And cats, they're not licensed for very long use, and you risk kidney injury in a lot of cats. So unfortunately, sometimes that's a lot to have to deal with. And then if you do a steroid, it'll certainly bring down the temperature, but is that bad as well, that you could get some other infection or have a problem? So if you have any questions about fever, let me know. I hope this was helpful for the first edition of Low Tech Whiteboard Learning.